We have Amanda Yembrick from Medic Mobile, an organization that's working to develop digital tools to improve efficiency and outcomes in underperforming health systems around the world. Please welcome her to the stage.
Can I get this stand?
Yeah, sure. Hold it for a
I talk
second.
with my hands too much. Awesome.
You might have to lower it.
Yeah. From here? Okay. All right, we'll go with that.
Okay.
Cool, thank you. So we're here this week to talk about building common ground, and to me, the most powerful tool we have to do this is actually data. And I came to this realization in February of 2010 when I found myself in Haiti a few weeks after an earthquake devastated the country. I was put in charge of data analysis for a needs assessment. We went to displaced person camps and asked about their access to food, water, shelter, electricity. I analyzed the results and presented them to various stakeholders, most of whom were used to working in an environment that was completely lacking any sort of reliable information. And amidst this horrible suffering and destruction, I saw amazingly passionate humanitarians come together over data and how they could use it to alter their response plans. I remember seeing a U.S. Army colonel high-fiving with a doctor at Partners in Health over a bright spot in the response that we were able to quantify for the first time. And it was that 3 months after the earthquake, finally there were 99% of people sleeping under a waterproof shelter at night. And since that moment, I have been working to find the most powerful ways of leveraging data for good. Did you know there are 1 billion people that will never see a doctor in their lives? People that live 100 miles or more from the nearest hospital where there is a single doctor responsible for the care of 250,000 people. It turns out that in many of these places, there is an existing community health system. The first community health worker I ever met was also in Haiti. Her name was Degencia, and she spent hours every day walking door to door, trying immensely hard to bring access to basic health interventions to her neighbors, talking to pregnant women about the importance of delivering in a health facility, and teaching children how to effectively wash their hands. She walked about 10 miles every week to deliver reports and pick up supplies from the nearest health facility. But like most community health workers, Degencia, she was a volunteer, she was barely supported, and essentially totally disconnected from the formal health system herself. At Medic Mobile, we build tools to support these health workers. They use our software to coordinate care and communicate about patients using their mobile phones. And we see that it works. Where health workers use our tools, disease outbreaks are tracked faster. More children are given access to life-saving immunizations, and more people receive critical treatment that we already know saves lives. For a specific example of this, just last month, an organization called MUSO that we're partnering with in Mali, that's a place where the under 5 mortality is one of the highest in the world. They just launched a massive expansion of their program into more rural communities. Now, they have an amazing model of proactive household visits where instead of waiting for illness to come to them, they actually go out into the community and seek to find sick children. So the MUSO health workers will use the Medic Mobile application to guide them through those visits and make a diagnosis. And in the first 2 weeks of their program, MUSO health workers identified 5,000 sick children that were then treated or referred to the local clinic for further care. I'll repeat it, that's 5,000 children that were going to get sick, whether or not those health workers showed up on their doorstep equipped with powerful mobile tools or not. So it turns out, though, that our tools are not just used at the point of care, but this approach is creating unprecedented visibility within health systems, visibility that brings people in. And I've seen what can happen when people rally around these data. Community health workers, when presented with information on their performance, will visit more families and provide a higher quality of care. When presented with data, health worker managers will change their supervision practices to identify those health workers that are struggling and provide them with extra support. And higher up in the health system, we've even seen that vaccine distribution strategies are changed on literally a day-to-day basis to respond to data and reach more people. So what we're seeing is that when technology makes it possible, data is being used to drive decisions and improve care across health systems. I like to remind myself every day in this work that each one of those numbers is the story of somebody that has had no voice outside of their family or their small community, people that have been passed over by their health system or forgotten by institutions around them. And each of these numbers is a real life. It's a real child being vaccinated and a real woman being monitored for danger signs in her pregnancy. And now I can sit at my computer in San Francisco and see when she safely delivers at a health facility. She is represented, she is cared for, and her story contributes vital data as all of us around her fight for health equity. Thank you.
Thank you for sharing with us your story about Medic Mobile and kind of your passion and what you're seeing in this space. I think one of the cool things about Medic's tools is just kind of honestly how well it works within those systems. And Medic's process for actually designing those tools, I think, is actually pretty innovative. And I was wondering if you could share just briefly about what that process is like for you guys.
Yeah, absolutely. So at Medic, we practice human-centered design, which you heard some of our cohort here speaking about as well, which involves really spending a lot of time in the communities that we work and with the partners that we work with, where we do a lot of iterative co-design with community health workers and their supervisors to really try to step into their lives and listen to what their challenges are and where some of the roadblocks are that they face in providing care to their neighbors. And we try to build our solutions around these problems that we're able to identify through the human-centered design process and kind of deep listening and role-playing that we do with them. And then we take those insights back and try to build them into our product with our product team. And that can look a bunch of different ways. We have about half of our health workers are working on basic feature phones, coordinating care with SMS messages back and forth. The other half are on smartphones now that are kind of using a more elaborate system to do point of care treatment at patient homes.
Yeah, and actually, I don't know how many of you guys know, but Amanda is actually a recent mother. She has a really beautiful little daughter. Kind of now being a mom, how has that maybe changed things for you in terms of how you think about working in healthcare?
Yeah, those questions actually go really well together, I think, and something I've thought about a lot in the last 11 months since my daughter was born. Empathy is a really big part of the human-centered design process, and it's something that all of our teammates at Medic Mobile practice, and it's something that we're all really work hard to bring to our work, and it's something I'm personally proud of the way we're able to bring empathy to these situations. But you can say we're being empathetic and imagine these different scenarios, but it's really challenged me since going through the pregnancy and birth process to think about what empathy really is. I was lucky I had a super easy pregnancy, but a very challenging birth that honestly could have turned out really differently if I lived in places where our partners are working and these health workers are working and these patients live. And that in that moment of going through that, I was able to kind of re-examine what empathy really means. And since then, it's challenged me after that point to try to dig a lot deeper and really think about the depth that you need to bring to these conversations to really get into that empathy.
Yeah, that's a really important reminder and great context setting, I think, for us as we think about our own work in this space as well. Yeah. Thank you so much.
Thanks.